Sorry, Shashi, I forgot to introduce you to the doctors. I'm sorry.
I think if we start, as and when we start, people can log in.
Thank you everyone for joining this webinar today. Jairamji, we can probably wait for another 2 minutes.
Yes.
We'll let more participants to join in.
Sure.
And
Sure.
right at 6:05, you can start, please.
It is now 6:03. I'll start in 6:05.
Yes, please.
Yeah, sure, sure.
Jairamji, in the meanwhile, can you please make me a host back? By mistake, I've made you a host.
So we will make you as a host.
Yeah, can you just make me a host again?
How do I do that?
Just go on the participant list and on my name on the right, you'll find an option of more. From there, you can turn that out. Turn that back.
Yeah, done.
Thank you. Thank you so much. It is 6:05 now.
So, Jatin, can we start?
Yes, please. Thank you.
Okay, thank you. Good evening, everyone. Welcome to another series of GACS webinar. As you are all aware, GACS is a nationwide chapter for the corporate professionals. And we are doing this webinar as a part of our continuous series. And today is a very special day for all of us in Bangalore, not only in Bangalore, entire India. We have eminent doctors on the platform today. And we have Dr. Roshan Jain, who is in Bangalore and who has been specialized in, in the last 4 months, he's been working hard with this Corona stuff. And we have Dr. Prashant Bhatt. Dr. Prashant Bhatt is a very reputed and well-established doctor in Bangalore. And he is also having tons and tons of experience in Ayurvedic and the other general medicines. And we also have Dr. Venkatesh from Apollo Hospitals, who's been, if you can see him, I think he's working from the hospital. And we would request all of you to be part of this seminar. And we welcome all of you doctors on this platform. A big warm welcome to you all. So now I would request Dr. Roshan Jain to introduce himself for a couple of minutes. Then it can go to Dr. Bhatt and then Venkatesh. Then I have my colleague Shashi, who's from GACS. He will start interacting with the doctors. Over to you, Dr. Roshan.
Thank you so much for inviting me for this seminar. I think this is a very important area because we've been going through the crisis for now nearly 5 months, and it seems it might continue for a few more. My name is Dr. Roshan Jain. I'm one of the senior psychiatrist and de-addiction specialist at Apollo Hospitals in Bangalore. I work at Apollo Jayanagar and Apollo Banagatta Road. I have over 22, 24 years of combined experience of working in psychiatry in India and in United Kingdom. And I'm also a professor of psychiatry at International Medical School. I've done now, I think this is the 15th seminar on COVID-related anxiety and mental health problems. So hopefully I'll be able to share some of my experience, but not just from seminar, but also from my extensive clinical practice during this lockdown.
Thank you so much, Dr. Roshan Jain. Very, very fabulous and phenomenal experience you have. Now I would request Dr. Bhatt to introduce himself to the audience.
Hi, everybody. I'm happy to be part of this elite panel today. I am practicing in Jayanagar 4th block since 1998 as an Ayurvedic practitioner. I have done my Ayurveda degree and post-graduation from Government Ayurvedic Medical College. Since 1998, I have been practicing here and trying to promote people's health and correct their lifestyles through Ayurvedic remedies. And I'm also part of a company called Ayurmatrix Healthcare, which we have started with one more doctor. I'm also in the teaching faculty of Ashwini Ayurveda Medical College, Tumkur. I'm a visiting faculty there. I'm also part of some other Ayurvedic health centers, which are located in Tumkur, where I visit periodically. So happy to be part of this. During this COVID time, we have been working to help people to promote their health and immunity. So
I will come back to you. I will come back to
yeah,
Dr.
yeah,
Bhatt once
yeah,
he
right,
introduces.
yes.
I would now request Dr. Venkatesh to introduce himself to the audience.
Namaste to all. Thank you very much for all for inviting me into this platform. My name is Dr. Venkatesh. I'm the senior consultant and head of the Department of Emergency Medical Services at Apollo Hospital, Karnataka region. So I take care of all 5 hospitals. So I'm in the emergency medicine since 22 years in Apollo Hospital. Before that, I was 3 years in St. John's Hospital. So I'm into this COVID task force since 4 months, managing in all 3 hospitals of Apollo in Bangalore. So we have a different experience since 3 months. Anyway, I think don't want to waste time. Let's go with the audience. What is their questions? Because they would have gone through a lot of these WhatsApp videos, a lot of TV channels, and gone through this COVID pandemic thing. So what is their doubts? It's better we will clarify to those people, and we'll make it simple. This COVID-19 is nothing but just a viral fever. It's just a viral fever.
We will talk about it.
So this I'll start, and this will be an end, and let's go to the audience, whatever they want. Thank you.
So thank you, Dr. Venkatesh, if I can put all your experiences together, you guys have 75 years of experience, which is very phenomenal. And that's a very, very happy thing to note. We would like to make this whole session more interactive and interesting. And we will discuss more about the contemporary and existing issues. I have my colleague, Mr. Shashidhar Sharma, who is Associate Director in Cushman Wakefield. We both are integral part of GACS. And Shashi has some interesting questions. And we will pose these questions to 3 of you. And with your experience, if you can able to support and answer these questions, then the second part, the later part of the session, we will have questions from the audience. We will start asking those questions. Shashi, over to you, Shashi.
Thank you, Jay. And first of all, doctors, it's our privilege and honor to be sitting with you, talking about this thing in such unfortunate circumstances. However, the kind of, as Jay said, that 75 years together experience, I'm sure that we'll get a lot of inputs from you. So thank you very much for that. So probably what I'm going to do, I'm going to ask each one of you one questions to begin with, and then probably we can get into a kind of interaction. As an Indian, I think I should give the first question to Dr. Bhatt. He's coming from Ayurveda side, so let me use this. And I'm going to ask a very I hope it is interesting, but Dr. Bhatt, do you think that Baba Ramdev's medicine?
Huh.
What is your opinion about that medicine, please?
Basically, see, as practicing doctors, we don't know much about Dr. Baba's medicine, like Ramdev Baba's medicine, because they have come out with a combination which will work on viral fevers. But the sad part was that they took the license saying that medicine is for immunity. Medicine is for immunity. And then later, once the license was issued, they came out and told that we have a medicine for corona. So that was the sad part. Basically, what we feel as Ayurvedic doctors is that in most of the viral fevers, Ayurveda has good remedies. And we have seen now over the years that Ayurvedic medicines work wonderfully well in such cases. Not only in viral fevers, even in viral hepatitis and herpes kind of infections. So many other viral infections of the eye and ear and different parts of the body. So in Ramdev Baba's case, what happened is medicine might work. So we don't know as yet because they have not come out with the clinical trial part of it openly. And they came out instead of saying that it is for immunity, because they took the license in the name of immunity and they named it as a coronil or something like that. And that is why the whole controversy broke out. That is a sad part.
Dr. Bhatt, I do understand. And just to, clear the confusion, my grandfather was an Ayurvedic doctor. So I have a lot of respect for this medicine. And my younger brother is a doctor who says Ayurveda is going to be the future. So I agree with you that we are into a very interesting situation with Ayurveda. I think it might come out with some solution. Let's hope for the best. So coming back to Dr. Roshan, and now Dr. Roshan, I have read a study on in MIT about the social distancing and face-to-face interaction part, mainly the collaboration, and where they've said a very interesting thought, what they have shared, that the lack of social interaction creates in mind the same kind of craving as hunger. So I'll begin with you on that. Basically, I understand this medical situation, it does create some kind of medical issues in terms of mental health. So what do you think about this statement first? And what do you think going forward? We are already seeing a lot of mental issues coming up. What do you see in front going to happen if it continues for another 6 months, which I believe first quarter of next year? What is your thought on that?
Well, I hope it's not 6 months. And by end of the year, we should have a good grasp of what vaccine is effective and when we'll get it. So my hunch is that by early next year, we'll have the vaccine with us and all the frontline workers will get it first. So fingers crossed. I think human beings are social beings, and we survive, we thrive. Everything that we are because of our social interactions. Language, for example, has given us that ability to develop higher cognitive abilities over other animals, to be able to communicate in language, not just in body gestures. And all our learning is principally by social learning, by social interaction, by communicating with people, by interacting with people, much more than reading and much more than being told. We learn from seeing things. And when we are around people, then we tend to learn, and our brain, our body function at the highest capacity. Now, when that is taken away from us, we're going to have a lot of negative consequences, and the negative consequences will be both on body and on the mind. But I think there's a phenomenal negative impact on the mind itself, because when our interactions are not happening in person, then we start to accumulate the thoughts. And when the thoughts are accumulated and there are no outlets for the thoughts, then it starts to take the form of an illness. So when from psychological point of view, we talk always about to say that when people talk, they unburden themselves. And from my clinical practice, I tell people to say that whatever is there in your head, whatever is there in your thoughts, there are only two outlets for it to come out of your body. One is in the form of tears and other is in the form of the mouth. So you can become emotional. That's a pretty healthy thing to do. And you become unburdened and you feel lighter when you cry. And I'm sure many have cried. I have cried many times. And when you talk, it unburdens your mind, it unburdens your heart. So talking is very, very important. And when we are physically distanced, as you mentioned, socially distanced, and WHO has recognized that it was a wrong terminology to use. They should have called it physical distancing, which means that we are separated from each other physically, but not socially, because we have the technology, we have expensive devices in our pocket. We need to use them more effectively to connect with people, to stay connected. And Prime Minister Modi very rightly said that, during the pandemic, during the crisis, enhance, maintain social distancing, but enhance social interaction. So you don't need to be disconnected from people. You connect with people, with family, with persons who matter to you as much as they did when there was no pandemic, but through the use of technology, like we are doing here, meeting so many people online and still maintaining the social interaction in order to maintain our well-being and our mental health. And the more we talk, the more we communicate, the better we feel, because sometimes we don't even realize what we think and worry about. But when we talk about our worries and when we hear our own worries with our mouth, then it just feels better. And from the mental health point of view, we always say that there is no substitute to the golden hour. Golden hour means spending 1 hour in therapy or spending an hour with a close family members, talking to them can give you remarkable results over and above everything that we do. Allopathy, homeopathy, Ayurveda, talking is the biggest medicine. And that's what I propagate all the time.
Thank you, Dr. Roshan. Very interesting point you put there. And I will like to pick up one point there, and which was something kind of information to me, a good information, that distancing is not all about physical distancing. It is also about the social distancing in terms of technology. However, do you think that it is the same thing as meeting one-to-one, face-to-face, where you can hug the person in front of you, you can, shake hands, you can, as Karan Virwani of embassy group said, I don't enjoy until unless I do high five with my team. So that's the kind of thing. So do you think is it really works on the electronic media alone?
I think no, it doesn't work. It's the second best. It's not the best. So it is second best. It's not third also. It's second best, because we need to make do with what we have. And there's been a lot of research already being in progress to look at the eventual consequences of not being able to do what is very human to us. We've always done this, touching each other, shaking hands, giving high five. The bodily gestures are as important as verbal gestures. And we will only realize the impact of that in time to come. But we already know that people are suffering and experiencing a lot of difficulties. For example, patients that I see from corporate sector who are working from home are having enormous difficulty of feeling more burnt out. So although, for example, today I consulted a few people from IT, they're not traveling, they're not spending as much time in traffic and chaos. They are mostly at home, and doing same amount of work or little more, but they are just feeling a bit more burnt out, purely because they haven't had human contact and human connections. They're mainly talking to the machine, they're leading to email reactions, and they're connecting with people on technology. Interacting with people on technology is more tiring as compared to interacting with people in person. So if I were to talk to you in person in my office, that would be much more satisfying than seeing you on the screen, because this is double whammy and doubly stressful. So this is second best, and I think we need to just do, it's better than nothing. And I think we will soon come out of this, and this is not going to be forever. Unfortunately, people were stuck in staring at the screens and social media and so on for hours and hours, and that has increased. And I hope people give up the technology to some extent after the pandemic is over.
I agree with you, Doctor, and we hope for the best there. And before I go to Dr. Venkatesh, I must say that you have not told us it is on emails you work, that will be also fine. So thank you very much for that. So second, this is still good enough for us. So I will go to Dr. Venkatesh. Good evening, Doctor. So let me not go there, whatever WhatsApp gyan we are getting from so many sources. So I will not go there. I will ask you a very basic question, which is on top of mind from, I am sure that all our audience. When do you think that vaccine, and I have got news that Russia has got it today, and they're already working on it. And this is all WhatsApp Gyan what we have, and maybe the next 2 months, 3 months, and the very important sources which I feel is correct sources, in my opinion, they're saying the first quarter of 21 will come. The second question to that, Dr. Venkatesh, will be, once we have the vaccine, I'm sure that it will go to the, our corona warriors like you first, and the administration and the legal and police, other various organized people. When it will come to the common man, that's the question I would like, because most of people have this question. Yes, Dr. Venkatesh.
Okay, coming to this about a vaccine, when it will come, it's a big question mark what's going on. So as of now, the trial 3 which is going on, which is expected early, is from the Oxford. So it's expected probably early next year. So some people are giving it in September, October, November. So it's all a big question mark going on. Still, we are in a big, but again, possibility it may come in the early next year. So again, the trial is still going on. So we can't really comment how much it's going to help to produce the antibodies and how much it's going to help for the people. Again, once the vaccine is there, the first what they are thinking is for healthcare people, because inevitable they are exposed more towards these people, patients. And if there is no healthcare workers, it's a very difficult challenge to manage the patients, which we are already facing. But the expected number of vaccines, what the production they are thinking, if it comes, healthcare numbers is just around 1 to 2%. So I think it will be enough for the people to public also to get the vaccine. So don't worry, it will be only for healthcare. The amount of production, the amount of competition, what's there, it will come to all public. So again, just the vaccine, we don't know still. Let's keep it as a question mark, and we should not worry about a vaccine, because this is simple viral fever. So it's not something big to worry. So just keep waiting for a vaccine. It's already, most of the people, if I can tell you, who is here, would have already infected, maybe asymptomatic, and they would have already developed an antibodies to themselves. So they don't require a vaccine at all.
So thank you, Dr. Venkatesh. On that note, it is a nice note to hear, and I think I will take this up next step. As you were saying, that most of us probably might be having the, had the coronavirus and already gone over it. So let me take you to the two basic questions. One is for Delhi. Our team is also from Delhi, and I'm hearing that 25% of the people already have a corona, and kind of we are heading towards herd immunity in Delhi. And that is one. And second thing, Bangalore is now growing up in terms of the number of people getting coronavirus here. So what are your opinions on the herd immunity in Delhi, and what do you think about Bangalore when we are going to have that?
See, knowingly or unknowingly, we are already gone into the herd immunity. So initially, when we all thought the herd immunity, when the United States, when announced, the herd immunity is the best thing. But again, some death rates happened more, and everybody started thinking, no, herd immunity is not good. But if you really take it up, the lockdown series of 1, 2, 3, 4, whatever happened, the lockdown series was just for a preparation, but not for the virus. It's just for preparation. The time it opened, you would have seen already the public was everywhere. So that was the time herd immunity was happened to everybody. So the community spread happened long back. So anyway, the people are telling it happened 10 days back, 15 days back, 1 month back. The community spread happened long back. Coming to the Bangalore, the Delhi, the infection rate started more, I think, because of some few reasons where there was a lot of conference, whatever it happened, and the infection started earlier there. Depends on the weather or whatever other phenomenons. But in Bangalore per se, they all thought like Bangalore, nothing will happen and we will be safe and the virus won't affect here. We are number one. But if you really see the way it is going up, because everybody took it very lightly, the lightly in the sense of a basic few precautions which people should have been done that they are not doing. It's not that something big they have to do. Hand washing is a simple technique, and keeping ourselves hygiene and cough etiquette. These are all the basic things which everybody should do, that people were not doing. So that's where I think this virus also showed all of us, okay, I think people need to learn this and behave in a nice way. It will be good for you. Otherwise, it's nothing big. If you really go back to the viruses, the viral pandemics in India, in 2002, we had a SARS and it was worldwide. Again, in 2009-10, if you see, there was a swine flu, H1N1, which was very, very high pandemic. But nobody knows about all this because there was no lockdowns, there was no media hype, which happened, and I think there was a lot of deaths what happened than the COVID-19 what we are talking at that time. But it was not shown by the media and lockdown, so the government didn't hype it up. That's the only reason it all just went like that. At that time also, if you all just recollect back, most of the people, we had some symptoms of flu. It can be cold, fever, cough, whatever it is, and we all developed antibodies at that time. That's why you're safe. The same way now also, if you go back into the COVID-19, there is almost around 80 to 90% of the people are asymptomatic. They're all getting it, but they're asymptomatic, and a mild flu symptoms comes for 3 days, 4 days, 5 days, and it's all going. So herd immunity is already happened. The community spread is already happened. So let's all take it in a positive way. We all developed antibodies to ourselves, and we are all safe. But
Thank you,
we all
Dr.
need to
Venkatesh.
have the precautions. We need to continue those etiquettes, which is very, very important. That's all. It is not for the COVID. It's not for anything. It's for any other virus also. We need to follow.
Thank you, Dr. Venkatesh, on that. And we hope that situation in terms of herd immunity is already there without most of people getting the burnt of it. And Vishwa is here. He's also working with a lot of ambulances and doctors like you. And what do you think the situation in terms of handling of the patients? And we keep hearing that this person has not got the bed there. So what do you think is the situation in Bangalore now?
See, the initial stages when it started in Bangalore, let me talk about Bangalore. Initially, when it started in Bangalore, there's hardly around 100, 200 positives, correct? So at that time, it all announced the government hospital, we will arrange 1,700 to 2,000 beds in Victoria, then 1,000 beds in Boring, some 1,000 beds in KC General. So every admission need to be done only in the government sector. Till a month back, even our own doctors who were positive in Apollo and so many other hospitals, they didn't allow to admit in the private sector. They wanted all the patients to go to Victoria. So they didn't allow us to make the preparation ready for the hospital to convert into most of the negative pressure ventilation, which is required for this virus. Or it can be with the AC with a high exchange of air. So those are all required some infrastructural changes. So in spite of kept on asking during the lockdown, they need to give a permission to the private sector, which I think for some reason they didn't give. But as little numbers, they didn't expect the numbers go high. But we were all, if you go back and see from so many hospitals, so many emergency physicians or ID specialists and epidemiologists, they all told by the end of May, June, the numbers will be very high. They kept on telling, but the government didn't expect that. Now, as the numbers went, so they don't have the manpower capacity or infrastructure capacity, they started putting suddenly to the private sector. So what has happened in the private sector? Some hospitals, it's if you go to any corporates, it's all like a centralized AC. So you are also getting non-COVID patients and a COVID patients also. So you need to differentiate between them, or else like you are unnecessary giving a COVID positive patient to non-COVID person an infection. So we are doing the triad system has to be very robust, where we need to identify and clear that he is non-COVID and take, or if he is COVID, we have to confirm and take to other area. So by this, when it started, initially every hospital started with few beds, like 10 bed, 20 bed, 30 bed, 40 bed. Now it kept on. If I talk about Apollo, Banerghatta and Jainaga, we started with 25 beds, then went to 50, then went to 75, then went to 100, then went to 125, 150, like this. So the time of arranging these beds became little difficult in the beginning. So when we used to get the patient, it was little tough for us to accept the patient at that time. But now and second, one more major problem, what happened, most of the hospitals admitted asymptomatic patients, which they don't require at all hospitalization. They just require to be at home. It's nothing but a normal viral fever. But every hospital started admitting the asymptomatic patient and started keeping them in the hospital for 7 days, 10 days, 14 days. So the beds were full. Now, at the time, the viral load was very less. The viral load was very less at that time. So, but anyway, the hospitals were happy. They just kept on, okay, all the recovery things were going on. But if you see now, since 1.5 months, the viral load started increasing and the numbers are high. Since a month, I can tell you. The symptoms are increasing more now, and the patients are becoming a little more symptomatic, which they really require a bed. But if you really see in this few days of every day 2,000, 3,000 positive per day or 4,000 positive per day, in that around minimum of 400, 500 patients require the beds. So there is there is no support from the government much to us, but still we are doing our best to admit the patients here. But it's because of the fear in the public mind, everybody wants an admission. They just get the COVID, some mild fever, mild cough. No, it will come to my family. I want to get admission. That's where the hospitals are challenged. It's becoming a big challenge. So my advice to request to all of you, if there is a mild symptoms, anyway, I'll tell you the symptoms later, better to stay at home. It doesn't require hospitalization.
Yeah, thank you, doctor. I think that's why all these kind of webinars are required, where we can pass on the right message to the people there. Thank you very much for that. So I will go for the last question with my friend, Dr. Prashant Bhatt there, because I started from him, and then I'll open this for discussion with the questions from the audience as well as our team. So open discussion. So before I end this one-to-one question, Dr. Bhatt, we keep hearing about this, hot spice
PM Satish,
water.
a patient our phone ಮಾಡ್ತಾರೆ ಜಗನ್ ಗಾರ್ಗು ಮಾತಾಡ್ತೀವಿ.
Excuse me, can you just mute this phone? So, Dr. Bhatt, we keep hearing about this hot water with spice, and we call it kadha and the tea. And I think it will also adds a kind of, it helps. What do you think is the effectiveness of this particular thing, as well as what do you suggest the kind of hot drinks with Ayurveda, your inputs, what kind of things we need to drink just for this?
Okay. See, this kadha is quite effective. So when we say these medicines promote health, that means to say that when you take these medicines, your chances of getting the infection that doesn't mean that you will not get the infection. Okay, so generally, see, there is no need for people to go and buy this kind of decoctions from the market, because all these spices are easily available at home. So people can which are mentioned in many messages, precautions. You don't have anything else to do in the day. So drink water, drink hot water, many other things. It's quite effective. Medicines are like takes are easily available at home. Maybe you can add one piece of clove into that, boil it, make it into half and drink it. That is one thing. Drink warm water, because warm water keeps your metabolism very active. And when your metabolism and liver is active, the fighting with the virus will become easy for the liver. That is the second thing. And third precaution we advocate is, when you go out, apply some coconut oil on your nostrils, like 1 drop of oil, because coconut oil has antiviral properties. You can take about 10 ml of pure coconut oil and rinse in the mouth. Like they suggest oil pulling. In Ayurveda, we call it Gandusha therapy. You put different kinds of oil in are used in Ayurveda, but in this situation, coconut oil is easily available in the market. So take 10 ml of coconut oil, keep it in the mouth, rinse the mouth properly every morning before you brush. That will keep your oral cavity healthy, and your immunity towards the respiratory infection will increase. The chances of getting infection will reduce.
Thank you, Dr. Bhatt. Thank you very much for that. So I would just request if Jay or Vishwa has a specific question to any one of the doctors, please go ahead and ask, and then we'll get the questions from our audience.
Shashi Jairam here. I have one specific question to Dr. Roshan Jain, because we are working, doctor. We are most of the IT companies in Bangalore, as you rightly said, are only 2% or 3%. Most of, a lot of people are working from home, but some of us are working from office. When we go to office, we are encountered with basic questions. If I have to ask you, Dr. Roshan, what are the first three things which you advise for a symptomatic COVID patient, and what are the best three things you advise for a asymptomatic COVID patient?
Yeah.
I think Dr. Venkatesh will be better able to answer that question. But we have been also running with the Jain Doctor Association, we've been running a helpline for COVID care helpline and then stress care helpline for the last 3 weeks. And we've been taking call and helping people as they call us and so on. So I think if people are asymptomatic, Dr. Venkatesh has already touched upon that it's a simple viral fever. And if not for the media, especially WhatsApp and proliferation of so much information, that we have forgotten the basic advisory about wearing a mask, hand hygiene, keeping away from people. These three advices are completely forgotten in the barrage of information that is coming to us through social media and so on. So people are not able to do simple things. So it's a simple virus which has a mortality or death rate of between 1 and 3%. So for example, if you compare that to SARS and MERS, SARS had a mortality of 9%. So out of every 100 people infected, 9 would die. And MERS had a mortality of nearly 35%. So this one has got a very, very low mortality compared to any other previous pandemics. It is very contagious, which is the worry. But with the information, people have got more and more worried. And as WHO said that we are in this pandemic, we have an infodemic, which means that we have so much information about the problem that we find it difficult to look at simple solutions. So if you're asymptomatic, most of them will not even know that. And I think more than 50% of people are asymptomatic. They're just getting infected. They might have a mild body pain or aches and so on, and then it just goes away. So there's nothing that need to be done about it. If you have mild fever, then there are very clear guidelines. Now the government is very clearly propagating to say that people need not worry about it. You continue to do what you're doing. If you have physical facilities like a separate room and a bathroom, then isolate at home. And if you can keep away from family completely and utterly in a separate room, then you stay at home. And if you can't do that, then you go to COVID care center. As Dr. Venkatesh quite emphasized, no need to go to hospital for mild infections. Sometimes if you're too worried, then you still can get checked up. If you're very old, if you have multiple medical problems, then there are other tests that can be done to ensure that the symptoms are only mild and it doesn't require anything more than COVID care center. If you are in a COVID care center where there are mild infections, then there are doctors and nurses to evaluate your health and who can then transfer you to a hospital where required. When I counsel people, I always tell them that you go to a hospital with a problem. Once you enter the hospital, then your problem becomes the problem of a doctor. So exactly, Dr. Venkatesh and myself will worry about the patient. The patient needs to be lying down, consuming medicines and doing what is required to be done to recover. So he, as I say in Kannada, the patient becomes like a madhve hudga, which means that he's a doula of the wedding. He doesn't need to do anything. Let the doctor worry. Let Dr. Venkatesh worry about the patient when they come in. Whether the symptom is mild, will it get worse, and what additional treatments that people, everybody now does know about all the antiviral drug names and hydroxychloroquine, whether it works or not, and all the data and all the research. And you know, there used to be a saying called, it needs to be a need to know basis. People do not need to know everything. They need to know only some things to say that if you're well, stay at home. If you're unwell and becoming unwell, then it's better to get tested. And if symptoms are mild, you still stay at home. If it gets worse, then you go to COVID care center where, you know, it's like a step down from hospital, from where they can be step up. So you can go to the next level if you get unwell. 80% of people, Dr. Venkatesh will agree, have no symptoms or mild symptoms. About 12 to 15% will get moderate symptoms. So they might become little unwell and more fever and so on, maybe sometimes little breathlessness. Only 2 to 5% of people will become quite unwell. And those are people who have multiple medical problems, which means nearly 90% of people are not going to have any major medical problem. It's just a simple viral infection. People have known so much about this and we've been educating everybody for 5 months, and still there is a lot of fear. And I think more than the corona fear of the physical aspect of the infection and disease, it has affected the mental well-being of people. You know, people are, take for example, 16 lakh people are affected by coronavirus of the 130 crore people in India. 16 lakh, I can't even tell you in percentage how low that is. I think at least half the Indian population is severely affected by fear, with anxiety, with doom and gloom, having insomnia, inability to function well. You know, whatever the causes and consequences of crisis are, the impact on the mind is far more than impact on the body. And we seem to have forgotten that. And we always do that. You see, we don't think the mind exists. We don't think our emotions and feeling exist. We don't even worry about our emotional reaction to illnesses and diseases. We only worried about, is it mild, moderate, or severe? You know, and when most people are not even going to be ill, then why worry about it? Why read social media posts? Why forward post? And why, talk so much about a vaccine, for example? You know, as Dr. Venkatesh very rightly said, most of you will not even need the vaccine. So why take it? You know, even if it comes, then you will probably not need it, because by then 70% would have been infected and will have herd immunity.
Absolutely, Dr. Roshan, absolutely, you're right. I think WhatsApp Gyan is a different university which we should not attend. So that's something is there. And just I will take it to Dr. Venkatesh, what Jay was also asking. One of our colleagues have asked from Delhi, what is the best and accurate test for COVID in Delhi, NCR region? Dr. Venkatesh?
See, as of now, if you see, the most of the people are just worried about a testing. So first thing I will tell you, if the person is asymptomatic, please don't get it tested at all. Don't get it tested unnecessary. There's going to be a huge pressure for all of you. So number one, if the symptoms, if there is a person is asymptomatic, in the up to 3 to 4 days, just isolate yourself, take plenty of liquids, take a symptomatic treatment. If you have a mild fever, just take paracetamol. If you have a cold cough or something, just take one cetirizine or antihistaminic, and take plenty of fruits and vegetables. So how we used to talk about an apple a day keeps a doctor away. This time we have to talk about an orange a day keeps a COVID away. So it's more of vitamin supplementations, what is required, plenty of liquids, and just relax. If the symptom persists after 5 to 6 days, then only you think of testing. So as of now, there are 3 testing things what's happening. One is about a rapid antigen, then rapid antibodies, and then about the RT-PCR. And some hospitals have a gene expert. The rapid antigen, if a person has more symptoms after 5 to 7 days, if you get a rapid antigen on 2nd day, 3rd day, 95, 97% it is coming negative. So it's always better. Hello, you're able to hear me?
Yes, yes, go ahead, go ahead.
If the person has a symptoms of more than 5 to 7 days, we have seen a study in our hospital with more than around 700 patients. 30 to 35% people are coming positive within 5 to 10 minutes. But again, if some people symptom persists, then only we are sending for the next level test called as RT-PCR or gene expert. The gene expert, the report comes in within a span of 2 hours. But again, the kits are very limited in some hospitals only it's available. Whereas the RT-PCR, it takes around 6 to 8 hours of time. But the best test, preferably accuracy, is RT-PCR.
Okay. Thank you, Dr. Venkatesh. On just taking that to another level there, I would also ask you that a lot of people have been talking about oximeter, and most of people actually bought it. Before this COVID, we didn't have anything beyond thermometer. Now we have oximeter in the room, in the houses. So what do you think is the range A? That is what is the range? And do we need to have it in house? As Dr. Jain was saying, that mental challenge will happen. But what is your view on oximeter and what is the range we should be worried about?
See, now if you talk about a COVID, we have to segregate it into mild symptoms, moderate symptoms, and severe symptoms. If a person has a mild symptoms, when we categorize, it's just like a mild fever. Maybe he would have lost his smell or taste, and some mild discomfort of throat, a mild dry cough, or sometimes it may be a little fatigue. So this will be a mild symptoms what we talk. And again, coming to this oximetry, yes, it's very important. The reason because this virus, whatever we are talking, it's a droplet infection and mainly affecting the lungs. So the respiratory symptoms initially we saw was a commonest, but now as we kept on going, we are seeing multiple added symptoms of loss of smell. Some people with the abdominal symptoms like diarrhea, vomiting, and also some people with sudden onset of strokes. We are seeing some intracranial bleed. We are seeing heart attacks. We are seeing with this. So those are all comes into only around 0.2% I'm talking. So just forget about that. So 90% I can watch the people are asymptomatic and they're all completely fine. And in the 10% who is infected, who require a medical attention again is only around 5% of the people. And in that again, that 5% I'm talking just around 0.5 to 0.75% people require a supportive treatment. So the ICU, what we are talking about is 1.1%. See, the oximeter helps if the saturation level is above 90 to 93% on a room air. It's a very good one. So it can go up to 94, 95, 97, 98. It all depends on your personal habits or how is your, how fit you are. If you're a good athlete, you may go up to 9900 also. If you have other habits like smoking, alcohol, other habits, it may be around 92, 93. And if a person having an asthma or some allergic bronchitis, he may range between 91 to 92. So we always not depend on that reading only. You should feel breathless. You should feel that difficulty in breathing. So don't depend on this digital numbers. Most of this pulse oximeters which is there in the market are not a good one. Before this pandemic, if you would have seen, the thermometers were accurate with all sorts of whatever ISI seal, whatever, everything was printed. Now, if you see in the market, there is nothing. A 10 rupees one with a pure, with a guaranteed thermometer is selling for 100, but there is no guarantee of that. So don't depend only on this digital number. You should feel breathless. You should feel very difficult in taking the oxygen, breathing, and matched with the oxygen saturation low. Less than 90%, we should worry that we need to come to the hospital. 91, 92% is in the mild to moderate, I can tell you, just in the borderline. Just try to do breathing exercise at home. It's really good enough. Now, this is the time people all need to start every day, do 10, 15 minutes of breathing exercise. The pranayama, which is proved really, really the best. It's a best thing for everybody to start now. You can keep the COVID away than depending on these hospitals.
Thank you, Dr. Venkatesh, on that. And Vishwa, do you have any specific questions? Vishwa?
Yeah, in fact, I was just thinking, since all the three doctors have a lot of queries and like questions apart from what we are currently hearing on the webinar. Is there any way that probably the corporate hospitals can kind of publish like on a media or even in their own hospital saying what are the plus points of corona, in the sense, how did the patient come in, and how when we are just seeing patients getting admitted, but we don't have the information of how many people got discharged other than just one small box in a corner of the TV, whether it's in media or not. So can we have some kind of like information from a COVID affected but recovered patient published across in some hotels, which will give us some more positiveness in the people?
See, if I talk about in the Karnataka region,
Yeah.
There's around 1,18,000 change people have been infected, right? It's confirmed
Correct.
cases. In this present active as of today is around 69,000 active. Means they
Oh,
have the COVID symptoms. The
okay.
recovered, if you see, there is around 48 to 50,000 is already recovered and discharged.
Yeah.
But still, I can tell you in this 69,000 active also, hardly around some 1,000 to 1,500 or 2,000 patients are in the hospital.
Oh,
Remaining, most of them are at home or so-called the CCC. The CCC is nothing but, I advise you, it's at your home. Some
okay.
people who don't have a feasibility of separate rooms where they can't isolate themselves or a mild fever, they can just choose the CCC center. It's nothing but a mild symptomatic what they're keeping there. And at the death rate, if you see, the whole Karnataka is around some 2,220 or 2,400 something as of today. But if you really go back and see the trauma deaths, what's happening in India, or people dying with the dengue fever, malaria, or tuberculosis, it's a very high number. So these are all just with our media hype and the lockdown hype, which made everybody, this is something big. So I can just tell you, it is in Karnataka region, there's hardly around less than 0.01% is what we are talking about a death rate related to COVID.
Oh,
Infected people who's going into critical is less than 0.02%. But if we
oh,
go back into the other deaths, there's more than around 1% and 2% I can know, the other diseases.
okay. Thanks, Dr.
Thank,
Venkatesh. I
thank
just have
you.
one quick question for Dr. Prashant Bhatt, and one for Dr. Roshan Jain before I hand it over to Shashi. A question to Dr. Jain is like, is there any way that we can do at our home? I do yoga. I'm a fitness person, so I do most of the activities at home with online courses. But is there anything that the doctor suggests where people can motivate themselves and try to be away from this corona news for some time, which will give them some positiveness? That is for Dr. Roshan. And for Dr. But I would request if you can kind of guide us on some daily intakes, instead of the regular coffee, tea. Is there anything that people can prepare at home and drink and kind of help ourselves with some immunity drinks? Only two questions I have, one for each. So probably if Dr. Roshan can put some lights on it, and then Dr. Prashant on the other question. Thank you.
Dr. Roshan, you have to unmute yourself. No, unmute your. Jatin, can you just check Dr. Roshan's? Can you unmute Dr. Roshan? I think you have put it there.
Yeah. Dr. Roshan, you have to unmute yourself.
Yeah. No, it was not letting me unmute. I think there's a lot of things that we need to do, and during a crisis, it is all the more important to be able to stand up to the challenge and face the stress and rebound from and recover from it. And this is what we call as resilience. Resilience is ability to face stress and challenge, rebound and recover. And life inevitably is very, very stressful. So, which means that we are, by nature of our existence, we all become resilient over a period of time. So we face challenges of life, and then we become resilient, are able to face up to future challenges in a better manner. But when we are facing challenges, then it becomes overwhelming to say that I can't handle and I can't manage it. And the way to develop resilience is to, as Dr. Venkatesh and already said, and Dr. Bhatt also already said, is that we need to foster wellness. And this is a need to do fostering of wellness much more now than at any other time. During crisis, we need to foster our body and we need to foster our mind. And fostering of the body simply means that we need to have healthy, nutritious diet. We need to have healthy routine. We need to have a healthy dose of exercise and activity. During the lockdown, people were doing home workouts on the terrace. Yoga is, and especially Surya Namaskar, can be done anywhere. All you need is a little space by the side of your bed. Even if you are in isolation, you can do Surya Namaskar. There were times when I used to do 50 to 90, 80 Surya Namaskar every day, especially when I was in England, where it was so cold that we couldn't go out, and I would just do Surya Namaskar in the morning, and I was as energetic as anybody else, or much more. So a healthy dose of exercise, and WHO clearly says that you need to do 150 minutes of moderate intensity exercise per week, which is about 30 minutes for 5 days per week you need to do. With that unlocking, people can go out, don't go out in groups, go out individually and still get that healthy dose of exercise, because nurturing your body with exercise, with nutrition and with good diet will help you to become more resilient, which or better able to tolerate the crisis and the overwhelm. And then you need to nurture the mind, and nurturing of the mind simply means that you need to be able to calm yourself down when there is chaos and turmoil outside. The inner turmoil very soon follows. So in order to manage the external chaos better, we need to be calmer in our heads, and that starts with pranayama, as we mentioned earlier. Deep slow breathing of various sorts we need to do to calm our minds down, to bring our mind and attention to the present moment, because when people are anxious and fearful, the mind wanders into the past and into the future. uh, uh, so these are the things you need to do. And meditation, where you can simply quiet, contemplate, and try to get at least some peace of mind, because it has been so disturbing for everybody that we are not getting any peace and solace. So you do meditation and you do calmness, or deep breathing and pranayama. So that is fostering of the mind. And then most importantly, you need to avoid negativity and negative outlets. So and the question of yours was to avoid social media. We need to monitor our screen time. We need to shut down. I, for example, stopped counting coronavirus. I think counting of coronavirus and number of cases and so on is not helpful at all. All we need is a little bit number of how many people have recovered. Maybe once a day in the newspaper, we need to know what are the status of corona numbers. We don't need WhatsApp news and forwards. We don't need to be in groups. We don't need to be in family communication, and we don't need to discuss about medicines and so on. It is absolutely and utterly unnecessary. So if there's any time that you needed to shut down your mobile phone throughout the day or major part of the day, then do it now, because now you're getting more and more proliferation of information, which is adding to fear, mongering, and paranoia.
Thanks, doctor.
Cut down the negative outlets, cut down the negativity and sources of negativity. And what you'll find is that you feel much better.
Thank you, doctor.
Thank you, Dr. Jain, and thank you, Vishwa. And just to let you know where Vishwa is coming from, we have GACS has a very nice tie-up with a good person called Thapa, and we call it NAKE in India. NAKE means nice. So where they use only the positive news. So that's where Vishwa is probably coming from. So we wanted those positive news. So I will go to Dr. Bhatt there, who will talk about, he's already talked about the kind of a drink we need to have, and also what Dr. Venkatesh touched upon and also Mr. Jain touched upon the pranayam thing. So I will add a little bit there, Dr. Bhatt, that pranayam, the breathing exercise, what we are talking about here. So we do Anulom Vilom, we do Bhramari Pranayam, then we do Bhastika Pranayam. So what do you say? What is the combination you suggest?
Anulom Vilom Pranayam will be the best for the starters. The only basic thing they should remember is, according to yoga principles, it should always start from the left nostril and end with the left nostril. Okay, that gives the very good positive results in pranayama. And one more thing I would like to say, Dr. Venkatesh said very nicely that you should listen to your body. I would like to add one more line to it. If you want your body to listen to you, you should start listening to your body. So,
perfect.
You should start listening to your body, so that whenever your body says something is wrong in your digestion, in your sleeping, in your bowel movements, please take care of that immediately, so that you are in a proper health and proper shape. People usually neglect the early symptoms, and when it comes to the neck, they rush to the doctors, not only in the COVID situation, even otherwise. So,
thank you, Dr. Bhatt. And I think I need to check with the Jatin what is the time we have, Jatin, and then we need to kind of go back to Vishwanath. But before that, let me also add what Dr. Bhatt is saying and what Dr. Venkatesh also said. You don't need an oximeter till the time you start feeling breathlessness. So let's listen to our body first. That's exactly what both of you are saying. So Jatin, how much time we have, Jatin?
Shashi, we are done with the timings. I think we have had enough. What do you say? Inputs
Information.
from the doctors. I would now request Vishwa to take over the vote of thanks and then give his final conclusive speech. Vishwa, over to you.
Absolutely. I don't think it's a speech, Jay, but on behalf of the entire GSES team, the members who joined the call, and especially the three doctors who have taken time, during this scenario and literally giving us 1 hour is actually, it is not a joke, I mean, I understand how Dr. Venkatesh, Roshan and Dr. Prashant are in their profile, but I really, it's really informative. And personally, for me also, I did have a friend whose daughter was
Vishwa, you gone mute.
really informative. I can go and tell him that, you need to go unnecessarily and get some tests done and all. I can probably motivate him. And, I would definitely like to thank all of you for joining this call and giving us this time. Back to you, Shashi.
Thank you, Vishwa. Thank you very much. Just to sum up what we have heard is that that we are kind of already asymptomatic and we are on the downward curve of it. We should not believe in the WhatsApp Gyan part of it. As Dr. Jain said, that mental health will become an issue. So let's keep on talking to each other. And the second best thing is getting on to the social media. So social distancing, get on to the mobile phone and do webinars like this. So that's what
Shashi, Dr. Venkatesh was trying to say something. Can we just hear him last?
Yeah,
Dr.
yeah,
Venkatesh,
sorry.
Dr. Venkatesh, go ahead.
Dr. Venkatesh, you online?
Yeah.
Yeah, please.
I just want to tell one more thing to all of you. If at all you have some symptoms and your people have got positive, please don't get worried. You don't require hospitalization. Again and again, I really want to tell you, until and unless you have moderate to severe symptoms. Most of the people are coming to the hospital feeling our neighbors will feel something, our apartment feel something, and we may give it to our own family member. Nothing like that. The time you would have got a test and already your family members would have been there with you. So they all were the primary contacts, they would have got the infection. By the time you just get the result, you're positive and you run away to the hospital. Not that you're not given the infection to them, you've already given to them. So better all of you stay at home, stay in isolation. So just follow the basic etiquettes, that will be enough. If you come to the hospital, I really want to tell you one more thing. If you people are mild symptomatic, your viral load is lesser. Please write it down. Your viral load is lesser. That's why and you have a good immunity. Your people don't have much infection. But if you come to the hospitals also, I'm not threatening the truth. Some people in the hospital will have a moderate to severe infections. Their viral load will be very high. So the cross infection may happen to you people. From mild to moderate, you also become. So just for some social obligations, don't rush to the hospital. The best is your home. So that will cure you better than the hospital. If you have moderate to severe, please visit the hospital. They will really help you. But before going, just give a call. That will be helpful to you. And please tell them once you go to because I've seen people enter into the hospital, sit in the OPD. Then after 10 minutes, 15 minutes, sir, I'm positive, what I have to do? The time you're infected, everybody in the hospital. Instead of that, in the entrance, please inform them that you're already tested outside and you're positive. They will really help you.
Yes,
one of the
safety
best,
of yours and
one of the
ours.
one of the best inputs, Dr. Venkatesh. I think.
And in fact, Jay, just to add to what Dr. Venkatesh said before we conclude, as you know, I have been monitoring from the last 40 days the COVID ambulance services, thanks to the GSES team, the support from BBMP and all, and I've been continuing. And trust me, most of the patients, when we call them, saying that, sir, the ambulance is arranged and can we come to pick you up? They say that I'm already fine. I'm not, or they say I have spoken to my family doctor and he's told me that I can be self-isolated and he can just be quarantined at home. So I think what Dr. Venkatesh mentioned is absolutely correct. Thanks, doctor.
Thank you very much, everybody. I think we have recorded, and I think Jatin will share to our members as well as to all the doctors. I personally thank all of you to being here. and such a wonderful knowledge session you have done. I think we need to learn the way. I think all of you are so expert in talking that we all need to learn from all of you how to talk on webinar. Thank you
They're
very
all
much, everybody.
they're all God sent angels, Shashi, for us. All the time.
Nothing, sir. We are normal human beings, sir. So let's please consider us as normal human beings. And
Thank you so much.
Jay, I thank Jay, Prashant, and Vishwa.
Yeah.
I think it was a great, and Shashidhar also, and also Dr. Roshan Jain. It was wonderful. I also learned a lot from you. Thank you very much. And Dr. Prashant, but it was very nice. Got some good tips from you.
Thank you, Dr. Venkatesh.
I will just add, I'm sorry, I'll just add, I think our group head is here of GSS, Samir. Samir, do you have anything to say, Samir?
I think he has to unmute.
Okay, fine. So thank you very much, everybody. Thank you very much. I'm so humbled and grateful to all of you. Thank you very much.
Thanks a lot.
Thank you,
Thanks a lot.
everybody.
Thank
Thank you,
you.
Dr. Venkatesh.
Thank you. Bye.
Thank you, Vishwanath.